Hello, I'm Marcus Boston. In today's quick educational video, we are going to talk about a rare but serious medical condition called placental abruption. Essentially, what placental abruption is it is when the placenta detaches itself from the uterus. And depending on how much of the placenta detaches can determine how much bleeding that the mother may have. And if mom is having issues with bleeding, then that can negatively impact the baby. As it pertains to placental abruption, there are certain types of risk factors that may be present for this condition. And some of them are if you have an older mother, a mother who is 40 years old or older, if you have a mother who's smoked, if you have a mother who's suffering from high blood pressure or infections, chorioamnionitis, things of that nature, these types of things can increase the risk of placental abruption. Now, although this can be dangerous for mom because of the bleeding and the hemorrhaging aspect of things, it can also negatively impact the baby. And you may be wondering, how can this happen for the baby? Well, the baby is developing and growing within the placenta. It's responsible for helping get the baby blood and certain types of nutrients. In addition to that, the umbilical cord also is attached to the placenta. So if mom is having blood problems and perfusion issues, then that's going to also impact the baby, because what it can do is it can reduce the level of oxygen and blood that the baby is getting. And if the baby is dealing with these types of issues, then that can allow the baby to deal with other types of complications, namely one called HIE, which is hypoxic ischemic encephalopathy. And if you looked at some of our other videos about HIE, you know that essentially it is a reduced level of blood and oxygen, which can lead to a brain injury. So although placental abruption is a rare condition, it is imperative that doctors diagnose it and they stay on top of it and they treat it. And in some instances, even a vaginal delivery may not be an option, and you may have to move to an emergency C-section. So I know I kind of talked about a lot in this video today, but I just wanted to help you understand this condition from a medical legal standpoint, placental abruption. If you have more questions, if you'd like to speak with me further, maybe you're here today because your baby has suffered an HIE diagnosis and you've got questions in regards to that, or maybe you had your placenta detached during labor and delivery and you're wondering, okay, did the doctors and nurses, did they catch it in time, or did they treat it the right way? If you've got these types of things going on, what I invite you to do is go ahead and pick up the phone and call me. There's a telephone number down below. I speak with families all the time about these types of issues. HIE, which we talked about a little bit today, CP, cerebral palsy, MAS, brachial plexus, and of course we talked about placental abruption today. One more thing before I get out of here. I practice law here in the state of Maryland in the United States. So if you give me a call and you are not in Maryland, just understand that I have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something that we can assist you with in regards to that. That's something we can try to help you with. But I just want to make sure that you understand the local counsel or the co-counsel aspect of things. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. We will see you next time. Take care and enjoy the rest of your day.